Establishing the President's Make America Healthy Again Commission. Purpose of the commission. American life expectancy significantly lags behind other developed countries. Before the COVID-19 pandemic, the average life expectancy in the United States was 78.8 years, while comparable countries averaged 82.6 years. This discrepancy equates to a staggering 1.25 billion fewer life years for the United States population. Alarmingly, 6 in 10 Americans have at least one chronic disease, and 4 in 10 have 2 or more. Furthermore, an estimated 1 in 5 adults in the United States lives with a mental illness. Health comparison with other countries. The United States faces an alarming health crisis when compared to global data. Across 204 countries and territories, the U.S. had the highest age-standardized incidence rate of cancer in 2025, nearly double that of the next highest rate. Between 1990 and 2025, the U.S. experienced an 88% increase in cancer cases, the largest increase among evaluated countries. The prevalence of asthma more than doubled in the U.S. compared to other regions such as Europe, Asia, or Africa. Children's health. These troubling statistics extend to America's children. In 2025, around 30 million children, 40.7%, had at least one health condition, including allergies, asthma, or autoimmune diseases. The rate of autism spectrum disorder affects 1 in 36 children today, an alarming increase from rates of 1 in 10,000 children identified in the 1980s. Additionally, 18% of late adolescents and young adults face fatty liver disease, with close to 30% of adolescents identified as prediabetic and over 40% classified as overweight or obese. Rising prescriptions and health concerns. The health burdens facing American children have escalated alongside the increased prescription of medications. For instance, over 3.4 million children are currently on medication for attention deficit disorder/attention deficit hyperactivity disorder, a rise from 3.2 million in 2019 to 2020, with diagnoses continuing to climb. Economic implications. These rising health issues pose dire threats not only to individuals but also to our national way of life. A startling 77% of young adults do not qualify for military service, largely due to health-related scores. Moreover, a staggering 90% of the nation's $4.5 trillion annual healthcare expenditures is directed toward people with chronic and mental health conditions. In essence, Americans of all ages are suffering from illnesses that our medical system struggles to address effectively, affecting our economy and national security. A call for action. To tackle this growing health crisis, a redirection of national focus across both public and private sectors is essential. We must strive to drastically lower chronic disease rates, especially in children. This mission requires fresh ideas concerning nutrition, physical activity, and healthy lifestyles. It also demands a critical reassessment of our over-reliance on medications and treatments, alongside an understanding of the effects stemming from new technological habits, environmental factors, and the quality of food and drugs. The establishment of the President's Make America Healthy Again Commission highlights a bold commitment to address these pressing issues. The time for change is now, and with these efforts, we can aspire to a healthier future for all Americans. Read the full text of this executive order in the link in the description.